Welcome back to the Morning Blend. Just last week, the Wall Street Journal published this article about the future of joint replacement without surgery. That future, though, is already happening here in our area. Dr. Scott Stanwyck and Dr. Kevin Tadych from Therapeutics are here to talk about this new approach to joint problems. Good morning, gentlemen.
Good morning.
Good morning.
How are you?
I'm doing good. It's great to see both of you. It's been a while since I've seen you and chatted with you, but this is really exciting, isn't it?
You know, it really is. We've just been going over some of our results and that we've had over the last 4 years. And other than a few times when it hasn't worked, we've had excellent results. And we think we're about somewhere between 80 and 90% effective at avoiding joint replacement.
And Scott and I, as orthopedic surgeons, we're constantly calling each other up. Did you hear how well this person's doing? So we're very excited. It's a great time for healthcare, in my opinion.
Yeah, it's a lot of fun.
I'm not surprised that you're both excited about this after all your years doing these types of surgeries. And I was reading in the article that you shared how common it is for osteoarthritis to affect people. So are we talking about things like sports and recreational injuries and things like wear and tear that maybe come from age or overuse? That's part of what happens that really makes things break down, right?
Right, and that photo right there is an MRI of a knee that's arthritic. And on the left-hand side of that, as you face it, the bone is white, and that's an area where the bone is actually, it's like a bone bruise. There's bone edema going on, and you have bone spurs forming, and yet there's still a little bit of joint space. And we have found that our results are quite good with knees like that. And then Kevin will tell you what that is.
Yeah, this slide represents periocytes, and these are the cells that we are after. And these cells live on your blood vessels, and these are your repair cells. These are in your body, and they come from your fat. This is a electron microscopy of cells from fat. And they're really not fat cells, they're periocytes. These are the guys that we're going for.
And they're living on the capillary bed there.
Are those in stem cells?
Yes, there's a controversy on what a real stem cell is, but yes, for all intents and purposes, those are stem cells, and basically they're your repair cells, and they have a lot of chemicals in them that direct your repair and healing of your body, and that's what it's your pharmacy.
So in the information that you shared, it talked about research that's being done that shows there's the potential to grow new cartilage as our own joints, which you mentioned, wear down from arthritis. So this comes from those cells. So it's sort of like using your body's what you have naturally to repair itself.
Yes, as a matter of fact, that's quite true. And we've seen many times people other than us who well, this is a perfect example of it. If you look at the top where it says before, the joint spaces are narrowed. And then where you see after, this is a year after, in this particular case, the bone spurs are still there, but the joint spaces are wider, which suggests that the cartilage has actually increased in thickness. So that does cause some cartilage, some improvement in the articular cartilage.
And that was a real case of a patient who was injected with those cells that we were showing previously, and increasing the cartilage of a patient. And that's what we're striving for. This is the goal.
I see that it sort of protects, repairs, regrows. And I was reading the statistics that you shared that osteoarthritis affects something like 325 million people. And there's 754,000 knee replacements and 448,000 hip replacements. So are we thinking then that we can avoid those surgeries?
Not all of them. We've had quite good results. Like I said, somewhere around 80, 85% have avoided joint replacement. So there's still going to be a place for joint replacement for the people. Like, for example, yesterday, one of the our follow-up patients at about 6 or 7 months. I sent her off for a total shoulder. She's just didn't respond. But most people do respond. And I just want to mention the things that seem to respond the best, other than shoulder and knee arthritis, or problems like Achilles tendonitis, frozen shoulder, tennis elbow, golfer's elbow, and other inflammatory conditions. And we don't always need to use the adipose or fat-derived cells. We can use platelet-rich plasma, which is quite easy. We just spin down a little bit of your blood and use that. And that works great for things like plantar fasciitis, tennis elbow, things like that.
And I think part of this, as we learn more, and this is obviously research in progress, is if we catch people earlier, I do believe they do have a better chance. So again, it might be a timing issue. We don't know, but even then, people that are late, we have a 94-year-old lady who came to us, was not a candidate for surgery, could barely walk in, and we gave her a treatment with her own tissue. She came in, no canes or crutches, and says she's the fastest lady in the grocery store with a shopping cart.
I love that so much. You guys,
That
was one of our favorites.
Oh, I can see why. Thank you both so much for joining us. This is such exciting news. We appreciate you sharing it.
Well, thanks for having us.
It's a great time for
healthcare. And one of the important things to know, though, is that insurance does not cover this. This is something that's still in the investigational stage.
I'm glad you mentioned that. Thank you both so much. That's an important piece. Have a wonderful weekend.
Thanks. You too.
Thank you.
Bye, Molly.
Bye, guys. This is so great to find out if you're a candidate. So if you've been told you need surgery to fix your joint problems, you may want to consider a second opinion from Transform Therapeutics. Give them a call at 262-264-5788 or visit their website. It's transformtherapeutics.com.